everyone. I'm Muriel Bowser. I'm the Mayor of Washington, D.C., and I am joined by members of my cabinet to provide district residents with an update on the district's experience with COVID-19. And we are going to talk about the city's posture. We, of course, I think when last we spoke, we talked about the end of our public health emergency, the public emergency that remains in place, and our experience with the virus, including the Delta variant. So I want to start off by thanking everyone who is already vaccinated. We can't state enough how important getting the vaccine is. And if you are eligible and have not claimed your free COVID-19 vaccine, we want you to do so as soon as possible. So let me turn to Dr. Nesbitt, who is going to discuss our current metrics and share her assessment of what that means, what the trends mean, and what DC Health is closely monitoring.
And thank you, Madam Mayor. What you'll see before you are the metrics, some of the key metrics that we used in our decisions for reopening DC in terms of having a phase 1, phase 2, and phase 3. The majority of the significant indicators at this phase in the pandemic became green in late June, early July, and at that time the district moved into phase 3. You will note here that there are some indicators that are of key interest, in particular the daily case rate, that have now become yellow again, indicating that we have moderate transmission in the District of Columbia. One of the things that I'd like to highlight is that several months, likely 6 months or so before the CDC created a continuum for transmission and created metrics related to the daily case rate and the test positivity rate, meaning their continuum consists of low, moderate, substantial, and high transmission. The District of Columbia had already committed to 3 categories of transmission: low, moderate, and substantial. As such, there is overlap between what DC's metrics indicate to be moderate and transmission and the CDC's definitions of low and moderate, and then there is overlap between DC's moderate category and the CDC's substantial category. So you will be mindful of that when you are reviewing and trying to understand from a verbiage point of view where the District of Columbia is in transmission. As always, residents and visitors of the District of Columbia are advised to follow the recommendations of DC Health in terms of any mitigation strategies that may be in place as a result of our current level of community transmission. Next, you will see that since the beginning of July, where we had great case rates with minimal to community spread, where there were levels that we had not seen since the very beginning of the pandemic. Over the month of July, or throughout the month of July, we have seen a 5-fold increase in our daily case rate, where we are now at a daily case rate over 8. After having experienced lows nearly at 1.5 cases per 100,000 per day. We have provided for you a conversion of what our daily case rate is in terms of the CDC's weekly case rate for people who want to make that comparison, and it is currently at 58.15. What we know in terms of the trends that we are seeing is that the greatest increase in our cases is attributable to young people and young adults. In particular, we are seeing a higher number of cases and a higher proportion of our cases occurring in 5 to 14-year-olds and in the 20 to 34-year-old populations here in the District of Columbia. Some of the activities, as we have now again begun to see increased participation with our contact trace team, some of the activities that are noted by positive cases in the district that they have participated in that are now seeing an increase over the past month are travel, internationally and domestically, dining out, and social activities. We'll also note that for social activities, the size or the number of people in attendance at the social activity that a positive person has participated in is now skewing toward larger groups. Whereas you may recall last winter, we spoke a lot about people participating in small gatherings of less than 10 people. We also want to make sure that people understand the impact of these case rates on our test positivity rate, which is also beginning to increase, was previously minimal and is now moderate. We do continue to have a high degree of testing in the District of Columbia, both through our private, publicly operated sites and our private healthcare providers. And our test positivity rate is now at 3.6%, which also indicates moderate transmission in the district. I want to highlight before we go to vaccinations that we continue to see disparities in who is getting infected in the District of Columbia, both from a race and ethnic perspective as well as a geographic perspective. We have done a tremendous job in terms of reducing the amount of new cases that occur in people over 65. We have about a handful of cases every week in that population of people over age 65, and essentially no racial and ethnic disparities for that population. However, when we look at our younger people, 5 to 14-year-olds in particular, Black youth are 3 times more likely to be infected with COVID over the past couple of weeks than their white counterparts. So on the next slide, you'll see where we are in the district in terms of vaccine coverage for people age 12 and older. All of this data continues to be available on coronavirus.dc.gov, where you can review and query our vaccination data from a number of perspectives. Here, we have provided you a graph of what coverage looks like in the District of Columbia, what fully vaccinated coverage looks like in the District of Columbia for our DC residents who are over 12 years of age, meaning the entire eligible population. Vaccine coverage is higher in wards in wards 3, 4, and 6, and is lowest in wards 7 and 8. Again, driving many of these gaps in coverage are not our population that's over the age of 65. We see very little difference in race, ethnic, and even geographic distribution of coverage for the population over 65. For the young population, those who are eligible for vaccination, 12 to 15, the current coverage, meaning they've had at least one dose rather, of the vaccine for Black youth 12 to 15 is around 14%. But when compared to their white counterparts, the coverage is 51%. So a lot of the gap we see in coverage is attributable to youth and young adults and not to our seniors. That will have a great impact on us. As we recall, in the earlier months of the pandemic, most of our cases were in seniors, people who are middle-aged with chronic health conditions, requiring hospitalization and substantial care. And now the pandemic, just like it has nationally, is skewing younger. But I want people to be mindful that young people can get COVID-19. Children can get COVID-19, and children can be hospitalized for COVID-19. So it is not considered to be acceptable for us to take our foot off the gas because the pandemic is now skewing to the younger population. And with that, I'll turn it back over to you, Madam Mayor.
Thank you, Dr. Nesbitt, for that update. And we, of course, will be available for your questions. And DC Health has recommended that given the trends and cases that we see, and that we want to get ahead of it and nip it in the bud as best we can. And we know that masks can be very effective in doing that. So beginning this Saturday at 5 a.m., I will issue by mayor's order the directive that people over the age of 2 must wear a mask indoors regardless of their vaccination status. And I know that DC residents have been very closely following the public health guidelines, and They will embrace this. Our businesses will embrace it, and we will continue to do what is necessary to keep DC safe. Let me also highlight sites for vaccination. You heard Dr. Nesbitt well that we still have a lot of our kids to touch, and a lot of families and kids, especially on the east side of our city. We want to make very certain that they know all of the opportunities to get their COVID vaccine. We are very excited about the giveaways that we have been now doing for the last several weeks with adults, and our attention for these fun incentives is turning to kids. So please look at those schools for the walk-up vaccination sites for young people 12 and over. Anacostia High School in Ward 8, Ida B. Wells Middle School in Ward 4, in Dorothy Heights Benning Library in Ward 7. So DC residents who are 12 or older show proof of residency and receive their first dose of the vaccine are eligible for a $51 gift card. We continue to work with our vaccine buddies who will receive a gift card at these sites for helping to bring unvaccinated friends, family, or neighbors to the sites to get vaccinated. Our community core, and I just read a really neat story about the community core and how they're gathering each day. I saw core members gathering on my way home in Petworth, on my way here from home in Petworth, who are going out to knock on doors. And since launching this program, we have knocked on more than 75,000 doors, engaging over 30,000 residents, and have also engaged almost 7,000 en route at parks, metro stops, and plazas, and transported more than 200 residents to vaccination sites in Ward 7 and 8. So this is, grassroots as it comes, door to door, neighbor to neighbor, to get people out to get vaccinated. We are also excited to announce incentives for our young people, as I mentioned, who get vaccinated against COVID-19. And new incentives will be available to DC youth between the ages of 12 and 17 who received the vaccine. Youth who have not yet been vaccinated will be eligible for the $51 gift card for a limited time AirPods at 3 vaccination sites that are only open to DC youth. Parents and guardians would also be eligible to get one of the $51 gift cards per child vaccinated at these sites. All district youth, not just the newly vaccinated, but all district youth who get vaccinated or have already been vaccinated will also be eligible to win big prizes, including an iPad or a college scholarship of $25,000. Additionally, 135 schools, all public schools that serve students between the ages of 12 and 17 will receive micro grants to fund their own events and prizes for students to get vaccinated. So this all will begin, the student vaccination incentives, on Saturday, August the 7th. So on August the 7th, here's how this works. These sites at Brookland, Sousa, and Johnson Middle School, these DCPS schools will open to walk-in vaccinations for all DC youth at Brookland, Sousa, and Johnson Middle Schools. At these schools, as I mentioned, you can receive the $51 Visa gift card. Additionally, the first 400 kids to get vaccinated at each site will have the option to forgo their gift card and receive a set of free AirPods. These sites will operate 4 days a week from August 7th to September 30th. We also want to make sure that all kids who are vaccinated are eligible to win the big prize. So for 4 weeks, we'll also be doing a drawing. Each week, we'll draw names of students in DC who are 12 to 17, and 2 students each week will win a $25,000 scholarship to any college. 8 students each week will win an iPad. And once we draw a student's name, we will contact their family, and the prize will only be available if the student is vaccinated. So now I want to be clear that these incentives are for young people to get the COVID-19 vaccine, but there are also vaccines that are required to attend school. And so students need to get their regular required pediatric immunizations, and Dr. Nesbitt will say a little bit more about that.
Thank you, Madam Mayor. We know that it's critically important for our children to be vaccinated and protected against all vaccine-preventable illnesses. And the way that we ensure that happens is to have them be vaccinated prior to beginning school. So we're going to work really hard with many of our community partners to ensure that there is equitable access to healthcare services to allow children to receive their pediatric immunizations. Now, I do want to note that while we're emphasizing pediatric immunizations, it's important for every child to have a well-child visit annually by their healthcare provider to be able to assess their physical health as well as their emotional and developmental milestones. So we don't just need you to get your vaccines. That's really important. We also want your child to get a well-child visit from their healthcare provider. But in order to help you with your vaccines, we're going to be launching on Monday the Vaccinate.dc.gov portal for families to be able to schedule appointments for their children who are the ages of 3 to 18 to get their routine childhood vaccinations that are needed for them to go back to school. Families will also be able to, as the mayor has mentioned, add a COVID-19 vaccine to that scheduling or to receive a COVID-19 vaccine by walk-up. In order to make this work and to ensure that all of the children who are in our school systems, public, private, parochial, public charter schools, we will be making sure that at least 2,000 appointments are available each week through the Vaccinate.dc.gov portal. Now, where healthcare providers participate in the portal, they will continue to have other opportunities for their patients to come in outside of the portal appointments. So there's substantial and significant opportunity for every family to be able to get their child up to date on their vaccines in time for school. The families will also note that the hours of the appointments are flexible, allowing us to meet the needs of many of our working families and to make it as convenient as possible for their children to be vaccinated ahead of going back to school at the end of the month. Thank you, Mayor.
That's awesome. Thank you. And the back to school school dates are before you, and there on the map you see the various sites throughout the district, and some dates to keep in mind. Families can be making appointments beginning Monday, August 2nd at 37 sites across the district. On Saturday, the 7th, those appointments begin and the youth COVID vaccine sites open. On August the 14th, we'll host a back-to-school community event. August the 20th is the first day back to school for DC public school teachers. August 30th is the first day of school at DCPS. And September 2nd is the first day of pre-K at DCPS. So please keep those dates in mind. I also want to remind parents that there is a great deal of information at the DCPS Parent University sessions. These sessions are virtual, and I recommend that you tune in so that all of the information that some of which we've talked about today and a lot of other information that DCPS has, you can find at these times, and I'm sure at your leisure. Starting this week, getting ready for pre-K, tips for a smooth transition into school. The next week, getting my child ready for school, all grades, August 17th, accelerating learning in and out of the classroom, and August 19th, mentally preparing myself and my child for the new school year. So obviously this is, a lot of kids are going back in the building for the first time, so these may be even more important sessions for parents to consider. I'm going to ask Dr. Nesbitt as well to review, and I think that we're putting this out today, the update for the first time in a while for an update to talk about updated school guidance.
Yes, thank you, Madam Mayor. It is extremely important for all of us, for our children, to be back in school learning in person this fall. It's a tremendous priority for our education partners as well as public health because we know the benefits that accrue to a child's social and emotional development when they are able to attend school in person, receive support from adults inside and outside of their household, as well as engage and interact with their peers. Today and tomorrow, in addition to updating our mask guidance, DC Health will provide updated guidance for our K-12 schools as well as our child care facilities. The key highlights to note in these guidance documents is that masks are required for all indoors, regardless of vaccination status. So everyone age 2 and older will be required to wear a mask indoors in our child care and school settings. We've also updated the definition of close contact for students such that any school that is unable to have the social distancing of 3 to 6 feet will be able to use a different standard for determining when children must quarantine when they've come into close contact with a student who is positive for COVID-19. It allows for an assessment as to not only distance, but also adherence to mask wearing during the time of the exposure. And then lastly, I just want to emphasize, DC Health will continue to recommend that social distancing at least 3 to 6 feet occurs in schools. However, we recognize that some schools will have a limitation in terms of being able to accommodate all of their learners and meeting this social distancing criteria. And as a result of that, our K-12 guidance prioritizes mask wearing and then makes recommendations for other layered prevention strategies that can be put in place in order for schools to operate. Our goal here is to make sure that not only students return to school this fall, but that we can keep our schools open by operating them in a way that reduces the risk for COVID-19 transmission. Thank you, Mayor.
Thank you, Dr. Nesbitt. So finally, let me talk a little bit about, we've gotten a number of questions about DC government and our requirements at DC government. And I want to be clear that we are working with our labor partners, and certainly we have investigated a number of options as it relates to vaccination. But I will be working with our labor partners to create a program for DC government. And home testing. Need a test, get a test. We haven't spent a lot of time talking about testing lately, but I do want DC residents to know that there continues to be free city-provided testing throughout the District of Columbia, as well as the Test Yourself kits. So we continue to have 4 fire stations daily. Is that right, Dr. Nesbitt? 4 fire stations daily, recreation centers and other sites where you can pick up your free kit. And we think that program is working pretty well. There are a number of people who take advantage of it. But by going to coronavirus.dc.gov/testing, you can see where the free sites are each day if you want to go in person. So with that, I think we're done with our update, and we will take some questions. Yes, ma'am.
Bowser, how will this impact indoor dining in the district, specifically if masks are now required indoors?
Same way that masks are required, except when you're actively engaging in eating.
So there's still an exception for eating?
Of course.
And then pertaining to gyms and other locations, can you just go through, because, you know, we've had this discussion before on confusion on when to wear and not to wear in different places.
Sure. So it applies to all indoors, and I don't know what other guidance has been updated.
That's
will need
correct.
to be updated.
That's correct, Madam Mayor. There is no exception for gyms. What you all will find this time as you review the guidance documents, you'll be reminded that we went through a process to consolidate all of the different guidance documents we used to use for every different sector or every different venue type down into one business operations guidance document. We noticed that the way that things needed to be implemented across different venues was pretty much the same at this point in our response. So the need for an exhaustive list of different documents by sector was no longer necessary. We do not have an exception for any type of indoor venue from the mask mandate. I think it goes without saying, as the mayor has highlighted, that we want people to still be able to patronize our restaurants, to eat indoors if they choose, and there is an obvious exception to wearing a mask when you are actively eating or drinking. That is highlighted in the general mask guidance that will be provided today or tomorrow.
Dr. Nesbitt, if I can follow up with you, you know, I think a lot of folks got the shot hoping that that would help, the vaccine, hoping that that would help end mask mandates. With what's going on, what do you say to those people who might feel that they were duped into getting the vaccine?
Yeah, well, I don't hear anyone say that they're duped. I haven't heard anyone report that to me, and I haven't seen any accounts of people feeling duped in the media. In fact, when we have heard from people who may have been a breakthrough infection, they remain grateful for the opportunity to have received the vaccine and continue to encourage other people to be vaccinated. And the reason why they're grateful is that when the rare occurrence of a breakthrough infection happens, again, the rare occurrence, those individuals have milder symptoms. The vaccines are working as we expected them to do. They continue to prevent severe illness, hospitalizations, and deaths. So again, it is not the prevailing thought of many people who have been vaccinated. We have many DC residents who are fully vaccinated that they have been duped by anyone in public health, but they continue to have a sense of gratitude for the opportunity to have been vaccinated.
Sam?
Mayor, when you go to places like the Harris Teeter, a lot of people aren't wearing masks or had stopped wearing masks. So I guess you're going to have to start wearing them again. Is it going to be up to the business to make sure that people do this?
Well, first, I think let's kind of rewind and remember how, what's the word that I want, how supportive that DC residents have been throughout all of this, and how willing they have been to follow the public health guidance. And how we all have recognized that in our response to COVID-19 that things have changed throughout the course of it, and we have to adapt to do the things that are best for the city, and that means going in with masks. Now, one thing that I've noticed, a lot of people still do wear masks. They never stopped, especially going into public places. I, for one, have always worn my mask when I go to the grocery store, mostly because I thought it was a courtesy to the workers there. But I think a lot of people have, you know, they haven't stopped wearing their mask. So I think it won't be a big lift for a lot of folks. I think what I hear from a lot of business owners is they find it helpful when it's just clear. If Dr. Nesbitt says we need to do it in DC, they have a very easy time telling their customers and their workers the same thing. So we want to be clear, and businesses can deny you service for not following their rules and our rules.
And there are no socially distanced rules in this at all?
The only change that we're making today is related to masking indoors. Yes.
I wanted to ask about private settings. What's your recommendation for somebody who wants to have a dinner party and have a few friends over? Should they be masking indoors at this point? And what about private businesses? You've been encouraging people to come back to offices downtown. Do you fear that this will have any effect on that if people are told they have to sit in a mask in their office all day?
We continue to tell people to mask, to come to work. Let me rewind. Yes, we continue to tell people to come to their offices and that we're open, just like we have been in DC government. And And I'll turn to Dr. Nesbitt about small gatherings.
Sure. We have continued through our guidance to encourage people to have, when they have a mixed attendance, where people are fully vaccinated and unvaccinated, that they offer an additional layer of protection by wearing a mask. And that's in any setting, whether it's a public setting or a private setting. We also encourage people to be mindful of who they are around all the time. If you are a fully vaccinated person who is immunosuppressed, you benefit from wearing a mask anytime you are outside of your home, and you also benefit from wearing a mask if you have guests inside of your home whose vaccination status is unknown or who have participated in activities where they may have had a higher risk of transmission. We continue to encourage fully vaccinated people to consider wearing a mask when they're in large settings, including outdoor settings that may be crowded, again, because it offers them another layer of protection. We want to be particularly clear that people who live with young children who are not yet eligible to be vaccinated, who live with people who are immunosuppressed, which means they may not mount the proper response to the vaccine, and to people who may have a more severe illness if they were to get COVID-19, you're benefited from wearing a mask because it helps to protect those other folks in your home who can't get that protection just by their own actions. So again, our recommendation is that mask wearing when there's a mixture of fully and unvaccinated people, when you need to be sure to be able to protect children under the age of 12, as well as those who are immunosuppressed and may not be able to mount their own immune response.
Can I ask a couple of questions about teenagers as well? You talked about the need to reach teenagers, especially Black youth. How is the on-the-ground effort going right now? Are you having conversations? Are those door knockings, are those reaching teenagers? And especially, how do those conversations go when a teenager is making a choice about a vaccine and maybe their parent hasn't had the vaccine yet?
Sure. So we don't find that there's a tremendous amount of discordance between the interest of youth and the interest of their parents. So that has not been our experience here in the District of Columbia. We have a number of things that we have done on the ground and will continue to do for youth and young adults. Again, highlighting here the incentive program that will be in place, that will be both the youth and their parents will become informed of. I think all of you know that we've made the gains we've made in smoking cessation and getting people to quit smoking because young people educate older folks, and we know those types of models and opportunities will be helpful. We also have a youth advisory council for COVID-19, which brings together some of the district's youth to talk about their own experience with getting vaccinated, to share why they got vaccinated with each other, and to be able to answer any questions that they have. So there's plenty of ways that we will continue to focus on youth to receive these COVID-19 vaccines, as well as encouraging their parents to assist them in getting access if they require such support.
Yes.
If I could ask you about some of the vaccine requirements. So for children, why not require, if this is one of the groups that you're seeing the largest increase in right now, and it seems like a group maybe you could require for school purposes, why not require children to get the vaccine, one? And then I have a similar question about DC government employees.
So you're talking to me?
Whoever would like to take that, yes, thanks.
So in terms of pediatric immunizations that are required for entry into school, we are putting a bunch of efforts in place. The mayor has highlighted them today in terms of incentives for youth, and we believe that we can make some gains with those incentives. We will continue to monitor the situation as we have throughout COVID-19 and may put other measures in place at a later date if we don't see the benefit of some of the initial activities that we will be implementing.
So you could require it for school children, you're just not going there yet?
By law, I can, that's correct. But at this time, we will give parents and families the benefit of continuing to receive education and information, allowing us to see how the incentive programs that were put in place through the end of September are working for our youth and young adults. Again, we know young people in the district get vaccinated. Right now, we have a disparity in terms of who is getting vaccinated, but we believe that with more help and support, we can get all of our young people there.
And then on the DC government employees, Mayor Bowser, do you want to require every DC government employee to be vaccinated? I mean, if you didn't have to deal with the unions, if you could just do it, would you do it?
My first priority is to make sure I can meet our government operations and do it in a safe way. So I think everybody should get vaccinated, let me be clear, including DC government employees. And I want to work with their leaders, their labor leaders, and their managers to figure out how we can do it in the best way, that our employees have access, they have all their questions answered, and we know how a certification program could work for us. We've started, as you know, and we are already implementing our return to work program. So we don't think vaccination is required to return to work because we're back in the offices already. We have, and I think I shared with you at an earlier time, also an incentive for our government employees to report their vaccination status using the HR portal that we use here. And Jay will remind me how many have done that already.
Mayor, as of last night, we've had over 52% of our employees respond to our vaccination status, and over 92% of those are fully vaccinated. And that means that 52% of DC government employees are fully vaccinated.
Okay, so and some more could be fully vaccinated that we don't know about, that haven't reported it to us. So that's been our strategy, to work with our employees to get them vaccinated. And the next kind of phase of this work will be sitting down and having some very serious discussions with labor leaders about how we move forward. I think that the labor units also want their employees to be safe and protected at the office. They also want the clients of their agencies to be safe and protected, and they also want the city to be strong against any of these virus mutations that come aboard. So stay tuned.
Doctor, if I could just follow up with you on that. Are you waiting for full FDA approval for children before requiring? Is that something that's holding you back?
No.
Okay, and then can you talk to us about the Delta variant? Can you update us at all about, last we heard, I believe it was 1% of new cases were attributed to the Delta variant, but I don't know if it was you, I think it was actually Dr. Shaw in that briefing, acknowledged that there was a very low percentage of new test positives that were being sequenced. Can you update us on that, on what percentage now is the Delta variant accounting for in new cases, and what percentage of new cases are you able to sequence?
Sure.
Thank you.
So we still see less than 5% from the data that we have, 5% of cases that are sequenced that are positive for the Delta variant here in the District of Columbia. You may also recall last week, I believe Dr. Shaw and Mr. Ashley updated everyone on a process that we have put in place by rulemaking that requires laboratories to test or sequence 10% of their positive specimens on a weekly basis. That rulemaking went into effect last week. The time period that we consider to be a week is Sunday to Saturday, so we expect to start receiving more robust information from our laboratories beginning next week. But that being said, there's some clear evidence out there that we see nationally in terms of how rapidly the Delta variant can spread. We don't want to make assumptions that we live in a bubble and that our residents who are traveling to other places aren't exposed to the Delta variant. Because of that, that's one of the key drivers in our indoor mask mandate that is returning, because we know people who are fully vaccinated, who are exposed to the Delta variant, have the ability to spread the disease to other people. So we're going to remain laser focused on this. We have a rulemaking in place that will increase the proportion of samples that are sequenced on a weekly basis. Now, I will remind you all again that In order for a specimen to be sequenced, it has to meet certain criteria. Chief among them is the PCR test can be sequenced, and a rapid antigen test cannot. It's a point of care test that doesn't yield additional specimen or additional amounts of the sample for sequencing. And there may be some other factors that come into play in terms of some very technical stuff around CT values. But I'll spare you for that, and just reminding everyone that every specimen collected will not necessarily meet the laboratory criteria for sequencing.
Okay, yes, a couple more, and then the last question here, yes.
Okay, a couple more public health questions. My understanding is that the recommendation is when you get a coronavirus vaccine, you shouldn't get any other vaccine within about 2 weeks of it. Does that recommendation apply for kids who are going to these back-to-school clinics and maybe signing up for another vaccine they need and also a coronavirus vaccine?
So a couple of months ago, the CDC advised, and even some other associations, including the American Academy of Pediatrics, that we do not have to have a time delay between people receiving the COVID-19 vaccine or any other of the routine childhood immunizations. So there is no need for there to be a delay. We have pediatric practices now in the district who are administering on the same day. Co-administration gets into a little bit more technical thing, but they're administering the vaccines on the same day without a 2-week wait. And there are no notable adverse events that have been reported or are of concern when this occurs.
Excellent. And are teenagers able to get the vaccines without a parental consent form at this point?
So district law and the law enacted by the DC Council allows for minors to give consent to vaccinations because the law is silent on the types of vaccinations. It is concluded that it is permissive for young people over the age of 11 years and older to receive vaccines without parental consent. However, practices and healthcare providers reserve still the ability to have their own operational policies as to whether or not they require consent for services in their healthcare system.
What's the policy for the district's clinics, like these ones that are giving
The
away
district doesn't operate clinics. They're not our clinics. They're the clinics of healthcare providers, and their policies may vary.
Got it. One last
Who's
question.
doing ours at the?
We are partnering with Safeway and Giant. We are also partnering with some of the federally qualified health centers, and all of our school-based health centers that are operated by federally qualified health centers, and Children's National will be offering vaccines through the youth-focused initiative.
Got it. Can I ask on an unrelated health question, not coronavirus? In Arlington, they are reporting bug bites that seem to be linked to the cicada eggs. It might be oat mites who are linked to these cicada eggs. Have we gotten reports of these bug bites here in DC?
I have no awareness of the issue you are raising.
Well, I hope they stay away from us. Thank you.
What do they say is happening with the bug bites?
The cicadas laid their eggs, and these eggs are attracting other bugs, possibly oak mites, and people are getting very unpleasant bug bites.
Okay. Okay, and then, all right, last round, starting with Mark, and we'll work over to the end. Yep.
Thanks. Just one off-topic question. Just before your press conference, the Chief Judge of the D.C. Superior Court held a press conference, a rather rare press conference for a Chief Judge to hold, reacting to your comments yesterday. And she said, to paraphrase, she said, well, quote was, "It was not fair of you to finger point, and it was not the responsibility of any one agency that would result in an uptick in violent crime." And she said that they are an independent agency. Doesn't matter that they're governed by the federal government or locally. They're independent. They're going by CDC guidelines.
They're not going by I have to stop you there. They're not going by CDC guidelines.
Well, okay, well.
The CDC doesn't say they can't operate.
Well,
I don't know what guideline
she's
you're
talking about
pointing to.
social distancing and getting large groups of grand juries of 23 people in the same room. And says she has talked to you about using some other space, but right now they're doing the best that they can. And again, I'm just wondering if you can, respond beyond just the,
Yes, and I'm sensitive, and anything that I do is not meant to finger point or lay blame, but I have an obligation to tell the community when I think the system isn't working, and that's what I think. I think the system isn't working. I know if organizations from the Smithsonian to DC government to the Washington Nationals to you name it, all kinds of organizations have figured out how to come to work in person. I have every confidence that the members of our criminal justice system can do the same. And, you know, I've gone over a lot of more than I care to, like, even remember of guidelines. And I haven't seen any that say people can't come into a room. More than that, you know, we have stood up an entire hospital in an alternate site. And we can support the courts. Yes, they are independent. I can't make anybody do anything. We can support them in helping their operations get going and get going faster. So it is unpleasant to have some of these things highlighted, and I have great respect for the chief judge and all the judges, but I also feel a sense of urgency that I wish they would share.
Two
Yes.
questions. Following up to, what Sam had asked prior to, before, talking about almost enforcement, are you then expecting people to report to ABRA if they see, you know, people unmasked inside businesses or different indoor spaces? And then a follow-up too.
I'm not expecting that, but that is certainly an avenue that it's available to people in alcohol selling establishments.
Okay, and then Dr. Nesbitt, I know there was information released last week talking about breakthrough cases, and that around 200 was like 0.05% of breakthrough cases in the district. Correct me if I'm wrong there, but I want to ask you specifically with the folks that you're seeing increased proportion of cases, and specifically with the 20 to 34-year-old populations. Do you have any information on how many were vaccinated and how many of those age groups have breakthrough cases?
Our breakthrough data is available on our website and will be updated again next week.
And that'll include the age breakdown as well?
Yes, what you have access currently to that dashboard that has age, it has race and gender, and it, I believe, also has whether or not people were hospitalized. So you can go there and find that answer.
Do you want to share with
I
people
don't have
right
it in
now
front
that
of
you
me.
have everyone's
I don't
attention?
have it in front of me.
Okay.
But be reminded that breakthrough infections are less than 0.05% of the fully vaccinated population in the district.
And that is something we plan to update bi-weekly.
Thursdays, right? Every
Thursday.
Correct, correct.
Okay, yes.
So how far back, obviously with the masks now, and I guess one question becomes, people are going to be wondering, how far back could we go with restrictions? Is everything on the table at this point, or do vaccines help us when it comes to, you know, how far we might revert back to how strict the guidelines could be as we follow the cases?
We hope, and part of Dr. Nesbitt's recommendation to us to act now is to stop it before it goes too far. And that is our hope. What I've learned with this virus is you can't make too many. We have to go with what the virus is doing in the country. As Dr. Nesbitt said, we feel very good about what we've been able to accomplish here in crushing the virus and getting people vaccinated. But we're not a bubble in the world, and so we have to be prepared. We know that we have done everything that we can to get the vaccine out, make sure our hospitals and hospital beds are prepared, and make sure that people can still function in the world. So I'm just telling you now, we know this virus is going to be around, and we're going to still have to function in the world. The kids are going to have to go to school. People are going to have to go to work. DC government services are going to have to be delivered. And that is how we go into the coming weeks.
Now, are there concerns with the mild symptoms? People will actually get tested, especially if you're vaccinated, you have some mild symptoms. Are there concerns that those people might not get tested, or as we try to figure out where we're at with this?
Well, we definitely, and we have highlighted over the last week, our testing resources, and for people not to confuse allergy symptoms with what might be COVID symptoms. And so listening to your body and getting tested if you don't feel well, staying home if you don't feel well, continue to be things that we ask residents to do to stop any spread. Okay, last question.
Yes, Mayor. What about Nats Park, Audi Field, outdoors, but obviously crowded? Recommendations, but no requirements. Is that?
That is correct, Sam. Right at this moment, large outdoor venues will not fall under the mask requirement. We're only making a change for indoors. But we do encourage, as I mentioned, in our fully vaccinated guidance as well as in our mask guidance, people who have certain conditions or criteria or home environments, we highly encourage them to wear a mask in any crowded setting, whether it's indoor or outdoor.
Thank you.
Okay, you have the last question, Julie.
All right, just wanted to see if you had a forecast of how long this will last and when we will be able to take masks off again indoors.
I don't.
Thank you.
I don't. Thank you.